gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. The doctor is in the house. If you have a pain, call the doctor. If you have a sprain, call the doctor. Let the doctor know what you're going through. Let him tell you what's good for you. Because the doctor is in the house. The doctor is in the house. Call the doctor. Call the doctor. Call the doctor. Call the doctor. Tell me what's happening now.
Hey, welcome everyone. This is Dr. Ron, host of Dr. Ron, Unfiltered, Uncensored, with Season 5, Episode number 1, Medical News and Opinion by none only Dr. Ron. Welcome, ladies and gentlemen. This is the first show of this year 2020, and as usual, I do welcome you with an attitude of gratitude, and what I would like you to do this week is say thank you, but really mean it. If someone does something kind for you, maybe your boss urges you to leave early so you can get a good seat at your child's basketball game or what have you, or a cashier treats you really good at the store, recognize it with a sincere thank you and be specific about why what they did matters. This helps you mean it, which is important. Mindless thank yous don't count, ladies and gentlemen. Recognition, even in small doses, make others feel great. But it also gives you a boost of joy, and it exercises those gratitude muscles. So with an attitude of gratitude, welcome to the program tonight. And as usual, this program contains medical information. The medical information heard on this program is not advice and should not be treated as such. You are encouraged to confirm any information obtained from this program with other sources and review all information regarding any medical condition or treatment with your physician. Ladies and gentlemen, as you know, we are in a climate of change, especially in medicine. I've been preaching to you about being the CEO of your own body. Be educated about your medical condition. Be educated about the drugs you take. Read about them. Be educated about the physicians you seek. Ask them if there's any, always ask if there are natural options for your condition. So this year, instead of having a lot of guests, we're going to have an educational year. We're going to talk about longevity and anti-aging and how we can age and stay young. And to do that, we have to talk about inflammation, because inflammation is the basis of most chronic diseases. We have to talk about systemic enzymes, because when you run out of systemic enzymes, 3 days later, you're dead. We have to talk about parent essential oils, the oils that are the substrate that make your body able to produce those essential fish oils that everybody talks about. So we're going to be talking with Professor Peskin. So you don't need the toxic marine fish oils, which are antifreeze for cold water fish. Interesting. We have to talk about a diet, the Mediterranean diet, and maybe reducing calories by 30%, and we'll get into that. We have to talk about pure air, pure water, and oxygen, photobiomodulation, and we'll talk a little bit about that tonight, about all the blue light we're exposed to, and how it affects us, how it decreases our melatonin level, how it ages us prematurely. We'll talk a little bit tonight about how the medical industry is not very, very honest. And lastly but not leastly, we have to talk about our gut. Our gut is our second brain. The bacteria in our gut, the microbiome of our gut, acts as our second brain. That is the place that contains 80% of our immunity. Now, you know that how I feel about electromagnetic fields. They are the cigarettes of tomorrow. We're going to look back on these Wi-Fis and 5Gs and 4Gs and say, wow, what did we do to ourselves? Because these magnetic waves interfere with the frequencies of our body, causing brain fog, tiredness, fatigue, muscle aches, and maybe some neurodegenerative diseases like Alzheimer's and Parkinson's. You know, we've had guests and specialists on this program that told us about studies that prove that when you put a phone up to your ear, the blood-brain barrier, which protects our brain from toxic material, that barrier opens up. And mercury and cadmium, lead, glyphosate, that's Roundup, how that gets into your brain. How do we protect ourselves? So we have to talk about leaky gut and leaky brain. And these subjects will be covered one at a time with some concrete examples on what to do and things that are not so expensive. I'm working on a pair of glasses right now that I think will do the same thing as the Tesla glasses that cost $400. I hope to put you in touch with someone where you can buy these glasses for $30. And we'll talk how they can help you get a good night's sleep even though you watch television late at night. So that's where we're headed this year, ladies and gentlemen. And lastly but not leastly, we're going to be changing podcast hosts. And we are going to be using something called Podbean, Podbean, Podbean. Now, Podbean has an app in the Google Play Store, and they have an app in the Apple App Store. With that app, you can listen to our program, and you can call into the program. And we probably will be giving awards for people that listen on that app. Now, this is all new to us, so bear with us, but this Podbean app is a small download for your phone, and it really works good. And this is the host that Joe Rogan and a lot of really famous people are using right now. So the Podbean, that's Bean, Podbean podcast app. Listen, learn, watch, enjoy, anywhere, anytime. So you'll need to download that app, ladies and gentlemen, or go to podbean.com to listen to our programs starting next week. Really exciting times. All right, so education, longevity, anti-aging, lastly but not least, when I was looking at the numbers for thyroid disease, 200 million people worldwide have thyroid-related diseases. 30 million in the United States, with another 15 million of silent sufferers. Okay, when you can't put the metal to the pedal, that's your thyroid. Okay, about 1/3 of Americans probably suffer from this. Cold hands, cold feet, depression, elevated cholesterol, constipation, thinning of the hair, waking up in the morning with a headache, problem losing weight, and maybe having some spaces between their teeth. Okay, so that'll be the basis for another program because it has to do with how you feel every day and how to age and be young. So you can't age and have chronic inflammation and be young. You can't have that energy while that's there. All right, so welcome to the program. Welcome, Dr. Ron, Unfiltered, Uncensored. We are on at the present time Pandora Radio, Stitcher, Spotify, Apple Play, Google Play. We're even on the Waze app for GPS. So you could get, we have 353 podcasts that we've produced so far since we started this 5 years ago. All right, so let's just talk about confusion and contradiction. You know, we're in the flu season, and it probably isn't because of a virus. That's a whole nother story to get into. Probably because of lack of vitamin D, lack of sunshine, and stress, which will definitely kill you. So, they have a disease. They do what's called an antibody test. What is that? In simplest terms, it's aimed at detecting a person's immune system responding to the presence of a specific germ. So, if a doctor suspects you have a disease X, and he thinks it's being caused by virus Y, he sends you for a blood sample. That sample is examined for the presence of antibodies, which are specific for this virus he's looking for. If you test positive for these antibodies, he says you have that disease. Okay, disease X is caused by virus Y. You have antibodies to Y, so you definitely have this disease. Then he says, you know what? There's a vaccine that can protect you from this disease. And this vaccine, what does it do? Oh, it produces antibodies specific to this virus. So now you're told you'll be immune from virus Y. That's a contradiction, in my opinion. In the first instance, when your body naturally produces antibodies to this virus Y, the doctor tells you you have disease X. But if the vaccine produces those same antibodies, you're said to be immune from disease X. This is a contradiction for good business. What kind of business? Medical monkey business. On the one hand, they diagnose more cases of a disease. On the other hand, they sell more vaccines. Isn't that crazy? So the same test they're telling you is you're either immune or you have the disease. I mean, it's just they're trying to get it both ways. Well, let's see where we're at here. So let's talk a little bit about cholesterol, because again, you know, this multi-billion-dollar, maybe $50 billion a year in these drugs that can cause Parkinson's disease, these statin drugs that can cause rhabdomyolysis. Before they came out, there was maybe 6 cases a year. Now there's thousands a year. People hurting, people getting brain fog. Your brain needs cholesterol, ladies and gentlemen. It absolutely thrives on cholesterol. So let's just take a little look about an article written by Michael McAvoy. Okay. So you've been told that cholesterol is either good or bad. Actually, you've been told that if you have a high cholesterol, you're going to have heart disease. But I agree with the author. These concepts are absolutely 100% false. Now, it may be true that if you have heart disease, you have high HDL levels, LDL, low density lipoprotein, and you may even have high cholesterol levels. But what's the distinction between the cholesterol in your blood versus the cholesterol in your tissues? That LDL, that low density lipoprotein and cholesterol present in your tissues, guess what? No one ever tells you this. They are there to protect your cells from the damaging effect of toxins, inflammatory fatty acids, and free radical activity. For heart disease patients, high levels of this LDL may be on the scene of the crime, but the LDL does not pull the heart disease trigger. Cholesterol and LDL, some people call this LDL bad cholesterol, are in effect the patsies. They're the fall guys for this heart disease, for this cholesterol scam. If 10 kids are throwing snowballs at somebody at a neighbor's window, and they all see the neighbor coming to the door, and the 10th kid is a little slow, and his name is cholesterol, he gets blamed for the whole episode of throwing those snowballs. But there were 9 others. So cholesterol is better described as an anti-fatty acid. Other anti-fatty acids include, guess what? Your sex hormones and your corticosteroids, such as cortisol. These anti-fatty acids protect your cells from potentially harmful and damaging effect of these of inflammatory problems. Okay? Cholesterol's anti-free radical activity, in fact, neutralizes the damaging effect of fatty acids and free radicals in your tissue. So what am I saying here? This is getting a little technical. Cholesterol is there to protect your body. It is a defense against toxins and free radicals. It's elevated because you have other things going on. You have chronic inflammation. And LDL is not cholesterol, and it certainly is not bad, like everyone's been told. LDL and HDL are lipoproteins. They are not cholesterol. They function to transport cholesterol to and from different parts of your body. The LDL delivers cholesterol. The HDL brings it back to your liver. They are not cholesterol. The LDL, which is the so-called bad cholesterol, is essential in order for your cells to make steroid hormones, such as pregnenolone, the anti-aging energy hormone, testosterone, which you need to maintain muscle mass, virility, and male characteristics. Cortisol, which is anti-inflammatory. Progesterone, which is the youth hormone that no one talks about. Estrogen and dihydro or DHEA. So give me the big chemical name. So well, you know what that means is your body cannot function without this LDL. And since cholesterol is a primary antioxidant, so think of cholesterol like vitamin C. It's an antioxidant. It gets rid of junk. So what happens when you get a lot of junk in your body and toxins? Yeah, the LDL goes up, but it's doing its job. It's getting cholesterol to your tissues. So there's a lot of research on this. I'm not making this stuff up. The defense and the high cholesterol LDL is in response to toxins, free radicals. Maybe you've been drinking too much alcohol. Abnormal cells. Inflammation. Chronic infections. Or maybe cancer. The defense of certain lipids is a mechanism by which the body attempts to stop inflammation and disease processes, stop illnesses, stop allergies, stop infections, stop pathogens. So if you have a lot of allergies, you may have high cholesterol, but that is not a marker for heart disease. So, if you left your body's inflammation go unchecked, uncontrolled, unneutralized, you would die. But cholesterol and other anabolic lipids are in many ways responsible for controlling all of this. Just remember, cholesterol levels will elevate naturally and should elevate when inflammation is present. When inflammation and free radicals, when you have a lot of these bad fatty acids and they're doing damage or they're rampant all through your tissues, guess what? Your liver makes more cholesterol. And the LDL, what does that do? I told you, it's a carrier. And out they go to the tissues. And guess what? They're doing exactly as they are supposed to do. Halt the cells from degrading and blowing up at the sites of inflammation. That's why LDL values will increase extraction. No surgery or any activity that involves damage of the cells. If inflammation, toxicity, free radicals, and lipid peroxidation are not resolved, cholesterol will continually set out to quell the fire. At the sites of inflammation in the body, these free radicals can directly and indirectly cause cholesterol and LDL to become oxidized. That's when they're bad. Because then these oxidized particles can pass through the layers of the blood vessel walls, irritate the blood vessels. Now you got more irritation and more inflammation. Now you got a vicious cycle going on. You know, LDL has been shown to reduce pathogens, that is infectious bacteria. It can bind them up and inactivate them. It can even bind up toxins. Some of these toxins that can cause you to die. So this is some of the things I want to bring you this year. Some of the real, unadulterated, unfiltered, uncensored news about your health and what you can do about it. So cholesterol is not the boogeyman. It's made out to be. Let's hit one other topic tonight. And this is titled, How Sleeping with a TV Could Age You Prematurely. So you see the way we're going here, ladies and gentlemen. I want to give you something to think about, some science, some practical things. This is going to be the core of the program for this coming year. We're probably going to have 40-minute segments and maybe twice a week. So we don't bog you down too much. We have a tendency, or I have a tendency, to give you too much information sometimes. And I really do want to talk to you at some point about breathing. If any of you go to YouTube and look up Wim Hof, W-I-M-H-O-F, the Iceman, the guy that really learned how to breathe and has a record for staying under the ice caps in North Pole and Alaska. Now breathing has a lot to do with your vagus nerve and how you stay calm. This vagus nerve is, boy, have we not talked enough about that? How it can carry germs from your stomach up to your brain and cause all kinds of diseases. All right. Don't let us digress from how sleeping with a TV on could age you prematurely. my brother and I remember the good old days because the way we did things when we were growing up probably was better than how modern technology supposedly improved our lives. And the longer we spend indoors and out of the sunshine with our faces buried in our screen, and in fact, in the screen of our choice now, because we have all kinds of screens to bury our heads in. It is not just our sleep time and attention spans that are getting shorter. The more of a techie you are, the shorter you may live. It's not just that sunlight is good for us, but we are increasingly finding out how bad artificial light is for us. Could too much of this lead to another kind of darkness like death? From the indoor bulbs above our heads, to the street lights, to the headlights on the road, to the electronics that surround us everywhere. We are constantly being exposed to an onslaught of high energy light known as blue light. Now, I'm talking about flat screen TVs, your laptop, your tablet, and your cell phone. It's no secret that blue light can disrupt your sleep. But did you know it could even steal your vision? It may have something to do with macular degeneration. Now we're finding out it can actually cut your life short. A recent study on fruit flies. Well, you'd be surprised how these fruit fly studies can be correlated with humans. In fruit flies, just 12 hours of blue light exposure shortened their lifespans by 10%. Test subjects exposed to blue light also exhibited eye damage, neurodegeneration for you people with Parkinson's disease, Alzheimer's disease, tremors. Test subjects exposed to blue light exhibited eye damage, neurodegeneration, and motor function impairments. And guess what else came out of this study? Certain flies that had been bred to have no eyes still showed major damage from the blue light. So what do you think? It's not just from the blue light you see, but what you're exposed to even when your eyes are closed. Like when you're sleeping with the TV on? Now, I know you're not a fruit fly. I have some friends that are fruity, but not fruit flies. But those little critters are strikingly similar to animals and humans, which is why researchers often use them in scientific studies before they go ahead and test people. Now, you'll hear a lot of garbage about how blue light is perfectly safe for you. But they're wrong. They just want to sell you more tablets, more televisions. So what do you do? How about taking some steps to reduce your exposure to blue light? So what should you do? Switch to the night mode or dark mode on your phone or tablet, at least a couple hours before bed. Download a blue light blocking software for your devices. Invest in a blue light blocking screen protector or a pair of blue blocking glasses. And as I said, we're developing one too. They're usually amber color and lightweight plastic. Replace your LED lighting with incandescent bulbs, because even lights that look white may contain a high concentration of blue waves. And in your bedroom, reduce light emissions while you sleep. Turn your devices completely off, because remember, the fruit flies with no eyes still had the same effects. If you don't have a choice and you must use LED bulbs, please choose the warm white varieties which contain less blue light. How about supplements? People always asking me, what should I take? Well, there are lots of eye vitamins. And these eye vitamins contain lutein, Lutein, zeaxanthin, Zeaxanthin, and the meso variety. They can help blue light from reaching and damaging your retina. And lutein has been shown to extend the lifespan of some of these fruit flies that age prematurely. In that study we talked about. So even though they age prematurely, it had them live longer. And there's supplements that are readily available. So I hope you open your eyes a little bit to blue light. But there's so much to know about blue light, ladies and gentlemen. It's with us all the time. And believe it or not, light is part of an electromagnetic spectrum. Part of the visible and invisible. And the high-efficiency green light bulbs are not as necessarily beneficial to us. Compact fluorescence. Guess what? Compact fluorescent bulbs, CLFs, contain 25% blue light. We talked about LEDs, especially the white ones. 35% of the light is blue light. Now, not all blue light is bad, all right? Because it's generally available to us during the day. I'm talking about the blue light that we get at night, or that we get all day in our homes. I mean, you're going to get blue light outside, but if you get it 24 hours a day in your home with TVs, with LED lights, there's going to be physiological effects. It's going to affect your hormones. It's going to affect the cells in your retina. Okay, because the cells in your retina are really part of your central nervous system. Because they're connected to your brain, what's in the back of your eye? The optic nerve. And it has rods and cones. Maybe you remember that from your biology classes. Rods and cones, the light-sensing cells. And guess what? They're important for this rhythm that we have, this circadian rhythm. Okay, so blue light disrupts this rhythm. Normally, when it gets dark at night, your body starts putting out melatonin. Bright daylight follows, resetting the clock, and it begins all over again. Okay? Exposure to blue light at night signals your body that it's daytime and consequently messes up your rhythm, which is crucial to a lot of your processes that are critical for your body and to live a long life. Number one, and critically, melatonin is not thought of as an anti-inflammatory, but it is. It lowers that production because melatonin controls the sleep-wake cycle. So light at night suppresses melatonin. There's different types of light. We're not going to get into that. But just know that blue light, even dim, just remember the fruit flies without eyes, even they had effects. And it affects other hormones, worsens your sleep quality. And when we talk about anti-aging, one of the things that's critical is getting a good night's sleep, between 7 and 8 hours only. And you're not going to get that if you don't have melatonin. And this should get your attention. Blue light at night can cause weight gain. 54,000 women were studied. They were working nurses. The greater the number of night shifts, the higher the risk for obesity. Okay, so if you want to be skinny, don't be exposed to so much blue light. And if you have a tendency to diabetes, blue light at night can raise your risk for diabetes. Artificial blue light alters blood sugar metabolism. Shift workers tend to have higher rates of obesity, higher triglycerides, and lower HDL cholesterol than non-shift workers. Blue light at night can raise your risk for heart disease. Again, because it disrupts this rhythm and especially in your heart. You know, your heart puts out a lot more electromagnetic fields than your brain does, probably 5,000 more. So, yeah, a lot of things that we talk about the brain are 5,000 times more for the heart. As we said, age-related macular degeneration can be caused by blue light at night. Okay, at least in animals. Okay, there haven't been a lot of studies in humans yet, but definitely in animals. Are you willing to take the chance? You know, they have studied patients for blue light, and they think it can contribute to glaucoma because these cells that in the eye are just rarely susceptible to damaging effects of this blue light. So they're thinking now, why not filter out that blue light at night, especially if you have glaucoma. But I always say, why get the glaucoma? Let's try and prevent it. Blue light at night may contribute to depression, may increase your cancer risk. But you need blue light. So if you're exposed to it during the daytime, it can help you sleep at night. There are types of blue light bulbs that can treat acne. You know, these people with the SAD disorder, the seasonal affective disorder in the wintertime in the northern hemisphere, where they don't have the sun like we have here in Florida. Blue light can help that. It can help healing some hormones. But what do? Look, get plenty of sunlight during the day. Getting more bright light during the day lessens your sensitivity to light in the evening and lessens melatonin suppression by the nighttime blue light. Okay? After sunset, I'm recommending using blue blocking glasses. Really important. And get these programs on your smart devices that block this blue light. Sleep, if possible, in total, complete darkness. Take off your glasses or your contacts when you're outside. And we talked about the supplements of lutein and zeaxanthin. So, ladies and gentlemen, this is Dr. Ron, Unfiltered, Uncensored. For the last 40 minutes, just talking to you. But this is what we want to do for the next year. Just bring you some information and interpret the crazy medical studies. I just saw one today where, drugs are supposed to be checked against a placebo. The placebo should be inert, so you can not only see if the drug works, but you also can compare side effects. Well, now drug companies are putting medications in the placebo to cause some of the side effects that the real drug causes. And for instance, if a drug causes nausea and vomiting, they're putting supplements in the placebo that cause nausea and vomiting. So they can say, well, our drug is no worse than the placebo. They're faking the studies and they're getting away with it. They're absolutely getting away with it. You must be educated. What I see coming, especially I see in 41 states now, they're going to license nurse practitioners. You're going to have a hard time seeing a physician. Your insurance is not going to pay for it. You're going to see a nurse practitioner who has an average education of 600 hours versus a family doctor that has 10 to 12,000 hours of education. You should be aware of these bills in your states. Okay? It's going to affect you. Nurse practitioners do not have the experience of a fully trained physician. Keep abreast of that. So we're going to have an exciting year. And then we're going to throw in some ozone. I believe in it. I have it. We're going to talk about red light. I have it. I use it. It's anti-aging. It's anti-inflammatory. It gets your mitochondria going. We're going to be talking about telomerase. You know, you only can live as long as you have telomeres. Telomeres are at the end of your chromosomes, and they provide the blueprint, so to speak, for your DNA to replicate itself. But when these telomeres get shorter each time they make new DNA. You know, this red light of a certain wavelength can give these telomeres and this mitochondria a shot and keep them younger. But so does a good night's sleep. So does controlling your stress. So does a good diet. So does getting rid of sugar and getting rid of toxic metals. Remember I mentioned earlier about cadmium? You know, it used to be the one place that we'd look for that is in cigarette smoke. It's present also, though, in food, car exhaust, house dust, and plastic. But more importantly, I think, they find it in chain store jewelry. In some cases, the jewelry was made of this purely toxic metal, cadmium. What do you think this Chinese jewelry is made of? And you got to keep active because sports promote cellular cleansing. And you have to have a nutritious diet. Really important. So that's our show, ladies and gentlemen. Glad to be back on. Remember, next week we will be on Podbeam. I'll send out a note to you, but please download the app. It's available on the Apple and Google Play Store for Android. And through that Podbeam app, you can call into the station, earn points, and we should have a good time there. Maybe we can get Joe Rogan on one night. But we definitely will have Dr. Wong, Professor Peskin, and a host of physicians to help talk about what the programs I outlined today about chronic inflammation, how to control it, parent essential oils, photobiomodulation, and probiotics. We need good intestinal health. 80% of our inflammation is from our gut. This is called the second brain. Okay. Thank you for listening. I appreciate everything. And if you like us, give us a good rating on Apple. That helps. And we'll keep you informed about our move over to Podbean. I hope all 353 of our podcasts go over with us, but we'll see. In any case, have a great night, a great weekend, have a great year, have an attitude of gratitude, thank someone tomorrow, and really mean it, okay? Say it with gusto. Okay, have a great one. Ciao. Ladies and gentlemen, thank you for listening to Dr. Ron, Unfiltered, Uncensored, with your host, Dr. Ron. We are here each and every week. Thank you for taking the time out of your busy schedule. We bring you medical news that you can use. Medical news that's up to date on drug reactions and interpretation of medical articles. We also have some great guests scheduled. So thank you again. Have a great week. Listen to us on Apple, Alexa, iHeartRadio, TuneIn Radio, Spotify, Stitcher. Ciao.